It's hard to believe that runner and yoga instructor Deb Mahan had a stroke and almost died.
Trying to get the strength back in the legs.
Just a few months ago, this active mom was laying in a hospital bed at Swedish Medical Center.
So they took me in to do a scan and found out a blood clot, I guess they said the size of like the first digit of your thumb, in my carotid artery in my brain, and I guess it was 100% occluded. So there was absolutely no blood flow, no oxygen getting through to my brain. I had lost everything on the left side of my body. So my face had completely fallen. It looked like a melted candle. Couldn't move my left arm, couldn't move my left leg.
What brought Deb comfort is when her son texted her a picture of this sign at the hospital.
#1 brain team. And he said the second he read that, he knew his mommy was going to be okay.
Doctors and nurses working at the Comprehensive Stroke Center at Swedish Medical Center have special training to treat stroke patients. The key is working smart and quick.
That's the one thing that we have control of is our time, and we reduce minutes by not going into a patient room. We do everything in a streamlined, systematic process so that we can treat that person as fast as we can. And what we know is that every 10 minutes that goes by, the chance of an excellent outcome goes down.
For Deb, doctors quickly realized they needed to get the clot out by doing surgery. Their diligence saved her life.
The entire staff at Swedish is just the most extraordinary group of medical people I've ever been affiliated with.
Little did she know, one of the nurses on the Swedish stroke team that cared for her now had been there for her several years ago as well.
Every time someone asks me about a hospital visit, I talk about this extraordinary ICU nurse that I had 13 years ago.
That nurse is stroke advanced practice nurse Whaley.
How about movement on the
13 years ago, she cared for Deb, who was diagnosed with a brain clot just 2 weeks after giving birth to her son.
Doctors in the ICU wanted me to sleep round the clock, and Michelle understood that as a new mom who wanted to be nursing her baby, I wanted to be able to keep doing that. I remember her looking at me and saying, "I'm a mom, I get it."
It's kindness that Deb has cherished over the years. Michelle, though, had no idea.
I didn't expect her to remember me.
Oh my gosh, hi.
Most people don't remember the ICU nurse.
So look at you. It's so good to see you.
While some things have changed,
That's the big boy now.
Oh my gosh.
That's my little baby in the bassinet, yeah.
their memory of each other remains the same.
But I remember abstracting your record and just instantly realizing, oh my gosh, I know her.
For Deb, Michelle's support was life-changing, both then and now.
The week that I spent with Michelle in the ICU really was about hanging on to hope. I was going to live, I was going to get out of the hospital, and I was going to be able to raise my son.
It's appreciation
I feel like I'm going to cry, I really do.
and gratitude that Deb has for Michelle and for everyone who cared for her at Swedish Medical Center.
Thank you, the staff of Swedish, for giving me back the gift of my life.